Magandang umaga po sa ating lahat. Mabuhay at magandang umaga. Assalamualaikum kung meron man po tayong mga Muslim participants. Welcome sa ating second online discussion series of the Women Rise Above COVID led by UN Women in solidarity with humanity and inclusion and Estoryahay, a network of disability-focused organizations with support from the government of Japan. Ako po si Marcel Aguilar at ako po ang magmo-moderate sa activity po ngayon. Today's session is the second of the first part discussion on leaving no woman behind during the COVID-19 pandemic. Kung kayo po ay kasama namin last week po narinig po natin ng iba't ibang CSOs at UN agencies tungkol sa sitwasyon ng mga kababaihan sa conflict, kababaihan po na nasa loob po ng mga piitan, mga indigenous women, internally displaced women due to conflict, stateless asylum-seeking at refugee women, at mga kababaihan na meron pong HIV/AIDS. Ngayon po, maririnig natin ang mga representatives mula sa mga disability-focused organizations at mga ahensya na tumutulong sa mga kababaihan with disabilities. Our discussion today is intended to generate inputs on the policy paper na susuporta po sa Senate Bill 2088 on ensuring gender-responsive and inclusive protocols and programming para po matugunan ang iba't ibang pangangailangan ng mga kababaihan during COVID-19, ibang public health concerns, emergencies at disasters. Tayo po ay nagre-record ngayon ng ang activity pong ito. Kung kayo po ay pumapayag na ma-record po itong activity na ito, kindly indicate your consent sa pagtaas po ng inyong kamay using the reaction button na makikita po sa ibaba po ng inyong screen, o kaya po ay pwede po ninyong buksan ang inyong mga video at itaas po ang inyong mga kamay, o kaya po ay isulat po sa chat na kayo po ay nagko-consent. Salamat po. We would like to acknowledge po lahat po ng mga participants po natin ngayon, galing po sa iba't ibang organisasyon, iba't iba pong sektor at mga geographical locations. We are tremendously happy that you are able to join us despite your busy schedule at baka pati na rin po Zoom fatigue. Tayo po ay kasama natin po ngayon araw din na ito, kasama po natin si Jojo at saka Jojo Mahinan at si Bayani Generoso na tutulong po sa atin sa Filipino Sign Language. Bago po tayo magpatuloy, magkaroon po muna sana tayo ng photo session para po makuha natin ang lahat po na kasama po natin ngayong umagang ito sa ating activity. Yung mga may kaya pong magbukas po ng video, pakibukas po ang inyong video para kayo po ay makita namin. So we would request the Secretariat to let us know kung tapos na pong makunan lahat po ng ating participants.
Sige po. Okay. Dalawang pages po tayo. So, humiti lang po muna tayo habang first and second pages ay pinipicturan. First page po, ngiti po tayo. 1, 2, 3. Okay. Okay, thank you po. Next page po.
Thank you. Wala na, picturean na.
Ngiti po ulit tayo. Meron pa pong isa. Ngiti po ulit tayo. 1, 2, 3. Ayan. Thank you so much.
Maraming salamat, Kami. Bago po tayo magpatuloy, may mga ilan lang po tayong paalala para po sa isang smooth at fruitful na session. Tayo po ay live na binabroadcast ngayon sa Facebook page ng Humanity and Inclusion. Sa ating pong mga kasamahan na meron pong problema sa kanilang bandwidth, pwede po kayong magtungo sa Facebook page po ng Humanity and Inclusion. Makikita po ninyo yung link sa inyong chat box or pwede po kayong pumunta sa Facebook, pindutin lamang po yung humanity.inclusion.ph. Sa mga participants po natin na nasa Zoom, pakisulat lamang po ang inyong pangalan. Kung kaya po, isama po natin yung ating initials po ng ating organisasyon. Pwede din po ninyong i-edit ang inyong pangalan kung gusto niyo pong ilagay ang inyong pronoun, kung he, she, or they. Sa mga kasama din natin dito sa Zoom, kung maaari lamang po ay paki-turn off po yung inyong mic sa buong session para po mabawasan din ang ating Zoom fatigue at nakikita din po natin yung ating mga kasama. Pwede din po ninyong buksan ang inyong video para po nakikita nyo po ang isa't isa. Kung hindi man po, gamitin po natin yung reaction button sa ibaba po ng ating screen para po ipahayag ang ating reactions. Doon po sa mga nangangailangan ng sign language interpretation, tayo po ay nagsa-spotlight ngayon ng ating mga interpreters. Pero kailangan po siguro ninyong pindutin yung view sa itaas po na portion ng inyong screen at pindutin po yung side-by-side speaker para po nakikita po natin ang ating interpreter. Maliban po dito, meron din po tayong captioner. Kung maaari din lamang po na yung ating mga speaker ay magsalita ng klaro at sa tama pong bilis. Pwede po ninyong pindutin yung CC or closed caption. Nasa ibaba din po ito ng inyong screen para makita po ninyo yung captions or subtitle. Pindutin lamang po ito at makikita po ninyo yung show subtitle para po nakikita po ninyo yung mga caption. Dahil po may mga presenters po tayo at mga reactors po mamaya, feel free po para ibigay ang inyong mga comments o mga question using our chat box. O kung maaari po ay pwede din po ipakiusap sa iba na isulat po ang inyong mga komento or question sa chat box na ito. Doon po sa mga nasa FB Live, we are encouraging you po to use the emojis at saka po chat para po maisama po ang inyong comments at questions. Nakakatuwa po marinig po sa inyo kung ano po ang pananaw ninyo dito sa ating activity ngayon. Feel free to write in English or Filipino at kukolektahin po namin ito mamaya. Sa pagkatapos po nitong May, meron pong pagkatapos po ng lahat ng online discussions, ang UN Women po ay magpapadala ng summary report sa lahat po ng mga dumalo sa lahat ng online discussions. Pero po mamaya, makikita po ninyo, meron po tayong graphic recording na isi-share bago po matapos ang ating diskusyon ngayong araw na ito. Kung may pangangailangan po kayo ng Certificate of Attendance or Participation, pwede po kayong sumulat kay Ana Vineles. Yung kanya pong email address ay isusulat po niya dito sa ating chat box. So medyo mahaba-haba po ang ating house rules. Pasensya na po. Before we go any further, siguro po ay tatawagin ko na po si Edward Elio, ang Acting Country Director ng Humanity and Inclusion para po formal na i-welcome po tayo sa activity po nating ito. Ed?
Thank you, Maricel. Magandang umaga. Nag-iingat po ako. Maricel.
Yes po, Sir Ed, okay.
Okay, salamat. Magandang umaga sa lahat ng nanonood sa pamamagitan ng Zoom at Facebook Live. Binabati ko ang ating mga panauhin na si Attorney Christine Yuson Chavez, Executive Director of the Philippine Commission on Women, Engineer Emer Rojas, Executive Director of the National Council on Disability Affairs, si Ms. Cami Adle ng UN Women Program Analysis, COVID-19 Humanitarian Action at kanyang mga kasama sa UN Women. At aking mga kasama mula sa Philippine Federation of the Deaf, Federation of Person with Disability National Capital Region, YDE, Nogan, Maulip, at ang aking mga kasama mula sa Istoryahan, isang online platform composed of organization of person with disability. This is organized by Humanity and Inclusion. The focus is to share lessons learned and experience patungkol sa COVID-19. The role of women with disability and persons with disability are being challenged in this time of pandemic. Ano nga ba ang ibig sabihin nito? Wala pang pandemya, madami na ang challenges at barrier o hadlang na nararanasan ng mga kababaihan, partikular ang kababaihan na may kapansanan. Ayon sa analysis ng Philippine Commission on Human Rights on Women with Disability in relation on the Convention on the Rights of Persons with Disability, Article 6, kung saan kumuha po ako ng 2 rekomendasyon sa 13 nakasaad dito, na sa tingin ko makakatulong po ito sa ating talakayan. Una, i-improve ang information about the situation of women and girls with disability, in particular, their access to social protection. Kasama rito ang adequate standard of living, economic employment conditions, and enjoyment of political rights of women with disability. Pag-itingin pa ang mga impormasyon, karanasan ng kababaihan na may kapansanan upang maging inklusibo ang mga serbisyo para sa kanila. Most of them are head of the family. And kailangan din po i-provide ng women and girls with disability and accessible information and reporting mechanism to detect, prevent, and combat all forms of violence, including sexual violence against women and girls with disability. Pangalawa, undertake consultation with women and girls with disability with a views to using this as a basis of implementing laws, reform and policy changes. Sa madaling salita, isama sa lahat ng pag-uusap ang women with disability, lalo na kung usapin ang inclusive COVID-19 response. Pati na ang usapin policy to combat sex and gender-based violence. Siguraduhin ang full participation of organization of women with disability sa lahat ng development process, pati na sa budgetary resources for the advancement of services and the rights of women and girls with disability. Study shows that women with disability, because of the pandemic, are increased risk for emotional, physical, and sexual abuse, which is compounded by the social context of disability, including pervasive
Si Ed po ata ay naputol, tama po ba?
Naputol po.
Okay. Sige Ed, babalikan ka namin mamaya, no? Siguro dahil sa umaandar ang ating oras, buksan na rin natin yung ating unang session, no? So mamaya maririnig natin muli si Ed pag siya ay nakabalik bago siguro matapos ang ating activity, no? Sige po. Ang ating pong paksa po ngayon ay dalawa, no? Dalawang parte po ang ating programa yon. Una ay meron po tayong situationer ng mga kababaihan with disabilities pre and post-pandemic. At mamaya naman po ay meron tayong session on women with disabilities, leadership and participation in mitigating the effects of COVID-19. So ang magsisimula po ngayon na magsasalita ay si Agatha Joy Hegala Cambra. Siya po ay board ng Philippine Federation of the Deaf sa Mindanao. Si Agatha po ay from Davao City at board member po siya ng Philippine Federation of the Deaf sa Southern Mindanao at siya rin po ang Vice President ng Davao Region Association of the Deaf. deaf. Magbabahagi po siya tungkol po sa sitwasyon ng mga kababaihan na may disability sa Mindanao. So, Agatha.
Switch interpreter, please. Magandang umaga po sa iyong lahat. This is Agatha speaking through the interpreter. Thank you for the introduction. Again, my name is Agatha Joy Hega Lacambra. This is my name sign. At bahagi po ako ng board ng Philippine Federation of the Deaf, Mindanao region. I'm also part of the Davao Regional Association of the Deaf Incorporated. Alam natin ang grabe ng apekto ng COVID-19 sa atin. I remember a time when we were able to go to the mall, to the church, to go to the beach, and to go on dates. We had family moments. We had personal moments to be with each other. We had access. We had the ability to go on public transportation. At syempre, may mga employment opportunities para sa amin. Yun nga lang, being a person of disability, dahil sa COVID, naging worse yung situation. Work has been a challenge, especially those who were forced to work from home. When I go on the Jeep, I usually sit in the front so that I'm able to communicate with the driver so that they know when I can get off. But dahil sa mga regulations ng IATF, I'm forced to sit in the back. And for me, with a communication disability, it's hard to let the driver know that I need to stop. These are things that might seem insignificant, but for us does make an impact. Sitting in the front of the Jeep, goes a long way when it comes for me to travel. So again, with all these challenges that we're facing, the skeletal workforce, my full-time job became part-time. And since we're all staying at home, we're not able to meet with our friends. Alam natin yung situation sa mga ayuda. Bukod sa kulang, dahil ako ay may disability, I have extra needs, and this is not taken into account when we are given support. Most deaf people can work. Deaf can. But because of the lack of appropriate response to the government for people with disabilities, we are always left behind. Even when we ask for masks, malaking tulong po yun sa amin sa budget. Gastos din po yung mask, and we have to go through other means in order to get this support. I'm lucky that I have parents that are very understanding. But one of the main issues that we have is the interpreter, access to information. Kung magka-COVID ako and I am to go to the hospital, will I have an interpreter there to help translate for me? And that's the big question. And I hope that we can find solutions. That being said, thank you so much for listening. Salamat po.
Maraming salamat, Agatha, sa iyong pagbabahagi. Sige po, marami pa tayo maririnig na mga ganitong kwento. Tinatawagan po naman natin ang mga kasama natin sa Visayas. Dalawa po magsasalita mula po sa Visayas. Si Ms. Amy Dava ng PDAO, Municipality of San Buena Vista, Antique, at si Ms. Devi Panela, Federation of Persons with Disability Associations in Iloilo City. Si Ami po ay Persons with Disabilities Affairs Officer sa local government po ng San Jose de Buena Vista, Antique. Siya po ay nagsisilbing WOW LEAP Coordinator for Region 6. Presidente din po siya ng Rotaract Club of Antique at miyembro po siya ng Provincial Council Technical Working Group on Disability in Antique. Siya po ay may orthopedic disability due to polio. Mamaya po ipakikilala ko po si Debbie. Amy.
Hello. Good morning, everybody. Hello, ma'am. Okay na po ba?
Sige po, padayon lang po.
Hello po.
Papa, tuloy lang po.
Sige po. Good morning, everybody. We are representatives from Visayas. And now we will be tackling the issues faced by 18 Antique local government units, 1 LGUs in Rojas, Cebu, non-government organization, and the local government unit in Iloilo City. Next slide, please. Women with disability have gainful employment, yung wala pa tayong COVID. They involve themselves in masseurs, as manicurists, as dressmakers, and others. However, during post-pandemic, they experience lack of access to information and communication, especially the deaf community, because they can hardly communicate with their environment. Given the lockdown,
Amy. Hello, Amy.
okay, hello ma'am.
Sige po. Sorry, nawala po kayo.
Okay, along with the previous issues, which is communication, 55% of 55% of women lack of financial support, lack decent opportunity and employment, and lack of skills as well. 45% women in Antique, Capiz, Iloilo, and some areas in Region 7 are women with disability. Next slide, please. Now, we proceed to the gains. The presence of sign language interpreters are helping a lot in terms of communication. The LGUs give support to each sector, specifically on the basic needs such as commodities, hygiene kits, medical assistance. Non-government organizations augment the areas that the LGUs cannot reach out. Our government also develop programs to support unemployment and give aid to the needs of the people through social amelioration program. Next slide, please. During lockdown, our situation worsened. We have number of issues on unemployment. Example are the newly graduates that do not have jobs. Second is bankruptcy of businesses and their owners. Third, emotional issues brought about by financial distress. People could hardly afford to pay bills. tuition fees, rentals, mortgages, and loans. Fourth, the lack of medical sustenance to important drugs. Women with lupus suffer during pandemic because their medication, hydrochloroquine sulfate, was once used as treatment for COVID-19 patients. Hoarding and lack of supply occurred. Fifth, people are afraid to commute because of the knowledge that they can acquire COVID if they associate with a crowd. Transportation groups are highly affected. These are the 5 salient points we observe in our area. Now, to support this, Ms. Deb will explain through our chosen case studies. Ms. Deb?
Next
Sige,
slide, please.
pakilala ko muna si Deb. Si Debbie po ay isang registered medical technologist by profession at siya po ay isang social civic volunteer for organizations that cater to the needs of PWD sa mahigit na pong 10 taon. She is also a member and former secretary of the Federation of Persons with Disability Associations of Iloilo City. At siya po ay nagsisilbi ding community manager ng Virtualahan Incorporated. So Debbie, you may continue. Salamat.
Thank you po, ma'am. So our main goal is to immerse viewers with actual experiences from the beneficiary mothers with disability in Ulikid Rehabilitation Center Incorporated. So we have chosen this center since this have a lot of women beneficiaries. Just to give the audience a brief idea, this is a non-government organization in Kalumpang, one of the districts here in Iloilo City that caters the needs of children with disability and also their parents who are troubled and having difficulty raising, educating, and helping their children. This is composed of parents with and without disability who organize themselves, aiming to promote quality life for their children with special needs. In the following slide, we kept the personal information of our mothers confidential, but the facts we provided here are the actual experiences they shared. For the first case, we have Mother A with neurologically challenged husband and child. Mental health is something that we must consider very important. Now we will tell you about Mother A. Mother A finished high school and her son is currently medicated and recently diagnosed with medical conditions due to his environment, in which is prone to mental health issues since he was physically abused by father, who is impulsive and manic. The child witnesses mother bruising and crying, and the worst part is the mother is the one sustaining the needs of her family. Our dear audience, women who are from class D and E socioeconomic status are more likely to experience physical abuse because out of frustration and inner turmoil, some fathers are not able to provide for their family. Mothers tend to put up with their husbands to keep their family intact. Next slide, please. It's already hard to have one child with disability. How much more two or three? Now let me show you another example, Mother B's story. Mother B is also a high school graduate, but she has 12 kids and they live in the slums. Some of her kids are neurologically challenged. They are enrolled also in the center. Since the pandemic started, classes ceased and some stay at home for almost a year without any activity. And due to financial constraints, the main priority is survival over education. Children with disability undergo anxiety and depression, and their mothers or the women with disability need to deal with it. So they do not know how to handle their children's tantrums. But we cannot blame these mothers who discipline their children poorly or harshly, right? Note that the mother is only a high school graduate and she's stressed because she can't teach what she doesn't know. And she can't understand well her children because she has other children to tend to and she needs to do the house manager, financer, and caretaker. These are just one of the many problems that the women with disability in Visayas face. Next slide, please. We summarize our points by identifying the gains and losses before and during the pandemic season. As mentioned earlier by my partner, Ms. Amy, unemployment is a big issue and the losses we face are pretty much devastating. The low-class family because they belong to the poorest groups. We all know that before COVID-19, mothers can roam around and do their parenting, livelihood, and send their kids to school. We gathered data from the center and found out that most mothers are emotionally drained, tired, and jobless during the pandemic. They also exhibit tenacity during abuse because they cannot live easily, given the lockdowns and they prioritize their children above themselves. Some aspects had been neglected, like their needs to nutrition, health, and affection, as indicated in the table. The children may suffer misinformation as well because mothers who belong to the poor community are illiterate. Only 25 mothers are employed out of 47 in the center, and most of them are working part-time jobs only since they need to focus at their homes and protect themselves too. They gave up their food, hobbies, and in general happiness because their family needs them. Truly, their love is unconditional. Next slide, please. Since most mothers are poor intellectually, financially, and lack support, they depend on the center to help them with their children and some of their needs. The lockdown had caused huge impact on the emotional aspect of children with disability because most of them became anxious and became attached to their classmates and friends in school. The center had given mothers and women with disability opportunity to work on other things. It also provided trainings, assistance in education, health for their children. Now mothers are facing the following losses: worsening or developing of new health conditions. Children are most likely to develop behaviors and change their attachment styles. They suffer emotional fatigue. And since they are in close quarters, since they are all at home, and they're living in the slum areas, they may suffer parasitic, bacterial, and viral infection. Mothers became depressed because they need to face the issues. Okay, for the positive impact, we all learned a lot of things. May I hand this slide to Miss Amy? Miss Amy?
Amy and Debbie, siguro we could just give our last thoughts on your presentation para magbigay daan din kay Miss Fe na susunod sa inyong presentation.
Okay pa. Miss Amy?
Last slide.
Apo. And to end this discussion, we would like to leave an important message to all of you, Miss Amy.
Okay. Sa last slide na ba?
Yes po.
For the positive impact of post-pandemic, we learned that women with disability discovered new skills. Example is gardening. Learned and reflected more of oneself. Family bonding was strengthened. Appreciated the idea of saving and valued health and safety. In return, the effects are the following: strengthen family ties and closer relationships, become wiser and resilient, being able to avoid misinformation, mending of broken connections, and children are involved now and they understand reality and family unites in fight against COVID-19. Lastly, we also have impacts of COVID-19 in general, and these are the following: underlying health issues that are not addressed or diagnosed, awareness of COVID-19 effects to us and others, gender-based violence in disability sector, especially violence against women and children, uncertainties like fear and trauma brought to us by the pandemic itself, and not being able to receive what is due to us, the poor and vulnerable. We would like, before we end, we would like to leave an important message to all of you. Ang babayi ginahalungan kag ginapalangga. In English, Miss Debbie.
Babae ginahalungan ka ginaplangga. In English should mean women should be taken care of and loved. Let's protect women and help each other rise amidst COVID-19. Thank you very much.
Thank you.
Maraming salamat, Debbie at Amy, sa inyong pagbabahagi. Next would be Ms. Maria Fe Maravillas. Siya po ang presidente ng Federation of Persons with Disability dito po sa NCR. Si Ms. Fe ay currently presidente po siya ng, siya rin po ang current president ng Las Piñas Persons with Disability Federation at siya po ay project manager ng Community-Based Enrichment Program for Children with Disabilities in partnership po with ASME. So sige po, pakinggan po natin si Ms. Maria Fe Maravillas.
Magandang umaga po sa lahat. Today I will be representing women with disabilities at the NCR at yung local situationer po. So I would like to focus on risks and challenges during the pandemic by persons with disabilities. So next slide, please. During the pandemic, higher health risks for those with medical conditions and frontliners. From various surveys conducted in the NCR, challenges in mobility top them all because we are confined at home. There's also a challenge in accessing services and support. There's also a challenge in accessing therapy and difficulty in buying medicines and difficulty in accessing information about COVID-19. So next slide, please. Across Metro Manila, the National Capital Region, a survey was done, and 93% of the respondents with disabilities stated they receive food relief from government. 43% receive other goods and social protection like the SAP or Social Amelioration Program funds. 89% need maintenance medicine, but a staggering 99% stated they did not receive any medical support or cash transfers from the crisis intervention units that the general population received. So most respondents were not aware of government priorities. So next slide, please. So what we did was we had to do coping mechanisms. So we coined it at catch. We had to collaborate, we had to adjust, we had to do technical learnings, we need to communicate better, and we need to focus on our health or be conscious about it. Next slide, please. So what we did was to collaborate together with individual supporters, clubs, rehab students, local government, the Las Piñas Person with Disability Federation, and NCR Federation started projects with persons with disabilities and their families. Using the data from survey, we identified beneficiaries. Next slide, please. Together, we reach out to the most isolated and forgotten families with persons with disabilities. Some of these projects were Give Hope from Home, Adapa Community Project by DLSU COSCA, Project COVID-19 Response from Green Foundation, and the CARE Project from Rehabilitation Specialists. Next slide, please. With NCR, from the data, because the people stated they receive basically relief goods. So we did a project with CBM regarding cash grants. With these 100 families received cash grants, developed a monitoring tool together with CBM, and distributed 2,000 relief packs with hygiene kits from DSWD NCR, and financial assistance worth 5,000 per officer in cities active Federation of NCR. Next slide, please. So we need to adjust, create more possibilities together. So we need to adjust to the new normal. We had to learn to do online training, webinars, blended meetings, doing online livelihood marketing, sharing information, issues and awareness raising through YouTube channels. Next slide, please. Also, we did a profiling and management system through IDMS. The data was very useful in the easy identification of beneficiaries for relief distribution, SAP or Social Amelioration Program 1, 2, and ECQ Ayuda beneficiaries, for livelihood assistance grant from TUPAD or DOLE, and cash for work, and also in the scheduling of the vaccines. So data is very important to this constituents with disabilities. Next slide, please. We need to communicate better, learn to use social media, from monthly meetings of the Federation to webinars for empowerment. Next slide, please. We link experienced agencies on counseling and receive training on recognizing the red flags and how to combat anxiety through meditation, referrals to counselors and doctors. And we organize a group of people with psychosocial disabilities to support people suffering from anxiety. Next slide, please. So how has the pandemic exacerbated the situation of women with disabilities? Next slide, please. Many women with disability. Next slide, please. Many women with disabilities and mothers of children with disabilities have become game changers. They became resource speakers, online sellers, trainers, facilitators. Next slide, please. To our community-based enrichment program, we implemented that project before with a face-to-face program. But because it's pandemic, we need to do it home-based. So we have a pivotal role done by women with disabilities and mothers of children with disabilities because they are trained to make this program more inclusive and be home-based, deliver the therapies and the exercises and the activities through home-based. Next slide, please. Also, one great impact was a convergence with companies, departments like DILG and DSWD-NCR, companies like Jolly Foods Corporation for disability awareness and sensitivity training, and create MOUs for more effective implementation and make it an entry point for inclusive employment. Next slide, please. So together, let us build an inclusive society for all. Let's make this pandemic face it all together and create endless possibilities. Maraming salamat po.
Maraming salamat po, Miss Fe, kay Amy, kay Deb, at saka po kay Agatha sa inyo pong pagbabahagi. No? Marami man pong issues na nakikita lalo na po na kinakaharap na mga women with disabilities. Napaka-encouraging po na malaman na may marami din pong oportunidad na nagbukas para din po sa mga kababaihan na tulad po ninyo at mga ginagalawan po din ninyo mga komunidad para po mas maging hindi lamang po productive, kundi mas mainam din po na ma-prevent din po yung anuman forms ng abuse, no? Pero alam naman din po natin na marami pa tayong pangangailangan na kailangan ay maging inclusive po ang ating mga komunidad sa mga pangangailangan po, lalong-lalo na ng women with disabilities. Maraming salamat po. We're now coming into the second part of our program. Our next group of speakers will talk about the leadership and participation of women with disabilities in mitigating the effects of the COVID-19 pandemic. Tinatawagan ko po, welcome back, Miss Aya Tiong Kosunit, coordinator po ng We Dare. Si Aya po ay Vice President ng Nationwide Organization of Visually Impaired Empowered Ladies. Siya rin po ang Group Coordinator of Women with Disability Taking Action on Reproductive and Sexual Health. So yun po. Miss Aya. Miss Aya?
Hello?
Apa, sige po.
Ayan. Okay, wait lang. Maingay eh. So, W there, Voices of Women with Disabilities, speaking for realities. We have here the logo of W there, Women Who Dared. Then next page, please. And we have a picture here, our group picture. We are the core group members of Women with Disabilities taking action on sexual and reproductive health and human rights. Next page, please. For our games before the COVID-19 pandemic, our group were participated in various activities since 2018. We represented many women with disabilities in these activities. Our aim is to give face to women with disabilities who are often left behind. We have two pictures here. The picture above was during the commemoration of Women's Health Day in 2018, and the picture below was during the sensitive education workshop in 2019. Next page, please. Another gain for us, for our group, was we conducted training, access to reproductive justice in 2019. WDR trainers were sent to Cagayan de Oro to conduct peer education training to our fellow women with disabilities, and we have a picture on that. We have two pictures also. This. Yes. Okay lang. Okay. These pictures, may naririnig kasi ko. These pictures of our group was we were having a meeting here to plan on how to formalize our group, their group, into a women's organization. During these meetings, we intend to work together and also to reach out to other women with disabilities through education, organizing, and advocacy. Next page, please. This page is the remaining pages is for audio. These are the challenges we faced before the COVID-19. These challenges were documented when we were involved in the research project of the Licahan Center for Women. For our first audio, please. Please play the audio, please.
Discrimination ng mga anak na ako. Yung hindi magandang pagtrato.
Hello?
Yung hindi pag-alaw ng magulang
Please
mo.
play audio.
Nag-play na po
Mga
siya.
naranasan ng discrimination ng mga anak na ako. Yung hindi magandang pagtrato. Yung hindi pag-alaw ng magulang mo.
Advice na lang ako tapos na. Hindi ko naririnig.
Yung iwan ka sa hospital bed na napakataas. Yung apirmahan ka kaagad ng waiver for radiation na hindi ka pa nanganganak. Yung nanganak ka, tapos nahulog yung bata sa kamay ng doktor at sa langgana. Yung nag-recover ka na tapos pabalik-balik sa'yo. 4 times na pabalik-balik sa'yo yung gumapirma ng waiver for radiation. Yung ikaw yung hinuling i-assist nung ilalabas na kayo sa ward ng ER. Yung mga tao dahil ayaw mong umurma ng waiver, ang sinabi pa sa akin that time, ayaw niya pang magpalaigit, gusto niya pa manganak ng mga
Okay na, Aya?
Okay.
Pwede na po ulit.
Okay. There are many violations mentioned here, but the most prominent is the forced sterilization narrated by Sarah Jane De La Rosa, a woman with cerebral palsy. Next audio, please.
Mga naranasan kong diskriminasyon ng mga anak.
Share ko lang po yung experience ko nung nagpa-check up ako sa isang hospital. May ramp naman po siya pero matarik. Kaya po yung sister ko na kasama kong pa-check up, hirap na hirap po magtulak sa akin kasi may kabigatan din po ako. May mga guards naman po doon pero nakatingin naman po sila sa amin pero hindi sila nag-attempt. Tuloy din kami kahit nakitang hirap na yung sister ko. Itulak ka pa paakyat. Naisip ko nung time na yun, paano na yung mga persons with disability walang kasama magpa-check up? Tutulungan kaya nila pag umakyat sa ramp na matarik? Parang kakalungkot naman kung hindi. At nakakaawa.
Okay na, Aya?
Okay. We have here two challenges mentioned by Maria Hazel Manalastas, women with mobility impairment, the physical and attitudinal barriers. Next audio, please.
Share ko lang
Ang babaeng ito ay may kapansanan sa paningin. Siya ay manganganak noon sa unang pagkakataon. Nakahiga na siya sa examining table ng hospital. Inay-ina siya ng hospital staff para malaman kung siya ay manganganak na. Habang siya ay nakahiga at nakabukaka, ilang ulit siyang inai. Sa pagkakabilang niya ay 5 beses yun ginawa sa kanya. Ang unang nag-ai sa kanya ay nagpakilalang doktora ng hospital. Nakaramdam na siya ng pagkailang at pagkahiya dahil hindi na niya alam o hindi na siya sigurado kung sino na ang nag-ai sa kanya dahil hindi naman sila nagsasalita. Matapos ang ilang beses na pag-ai sa kanya ng ilang taong di niya tiyak, siya ay pinabangon at sinabihang hindi pa siya manganganak. Marami pa raw silang pasyenteng dapat asikasuhin.
01 voice slash 05 slash voice
Okay.
Okay na
pause
po.
button.
Okay, ang challenge natin dyan ay yung insensitivity of healthcare service providers narrated to us by Rowena Morong, a woman with visual impairment. Next audio, please.
Lack of sign language interpreter. Ang pasyente ay isang babaeng deaf. Nagpunta siya sa ospital kasama ang kanyang ina na hindi naman deaf. Gusto niya magpa-check up dahil sa lakas ng kanyang menstruation monthly period. Pagdating sa admission area ng hospital, agad na kinausap ng nurse ang ina ng pasyente nang malaman niyang deaf ito. Noong pinapasok ang pasyente sa loob ng kwarto at pinahiga sa kama, pinalabas na nila ang ina nito at sila na raw ang bahala sa pasyente. Ayaw man na mag-ina ay sumunod na rin sila sa sinabi ng nurse. Habang nakahiga ay walang kumakausap sa kanya. Nakikita niya yung mga staff ng ospital ang mga nag-uusap sa harap niya. Matapos siyang suriin ng doktor ay agad pinasundo ang kanyang ina. Pagkagaling sa examination room, tanging ang nanay lang ng pasyente ang kinakausap ng doktor. Kaya lumabas sila ng ospital na wala siyang maintindihan sa nangyari sa katawan niya.
Okay. Another challenge for our deaf sisters, lack of interpreters narrated by Rochelle Taborada, a woman with mobility impairment. For our last audio.
Ilang araw na sakit ang kanyang puso at di na niya matagalan kaya nagpasama na siya sa kanyang ina sa ospital. Siya ay babaeng may kapansanan sa paningin. Pagdating sa ospital, Nanay niya ang tinatanong ng nurse nang mapansin nito na siya ay bulag. Pinupo muna siya sa waiting area at nagpatuloy na nag-uusap ang nurse at ang nanay niya. Nang tinawag na sila sa kwarto ng doktor, mas hinakausap pa at pinapayuhan ang nanay niya kaysa sa kanya. Maging reseta ng gamot at kung ano ang nararamdaman niya ay hindi direktang ipinapaliwanag sa kanya. Bago pa sila lumabas ng kwarto ay sinabihan pa siya na sumunod kung ano ang sasabihin sa kanya ng kanyang ina.
Okay, another challenge for our visually impaired sisters, lack of access to information narrated by Michelle Balse, a woman with visual impairment and hard of hearing. For my last slide, the last page, let me summarize with you the challenges before the COVID-19 and add some more. We have mentioned the insensitivity of healthcare service providers and also lack of knowledge and training among them, especially on how to handle persons with disability. And for environmental and physical barriers, we can add to this the inaccessibility of health center equipments for person with disabilities, and communication barriers, sign language, lack of sign language interpreters, no materials on braille for blind people, and also no materials on large prints for low vision like me. And then another is, of course, sterilization, lack of privacy, discrimination among women with disabilities, violence against women with disabilities. Thank you for listening. Magandang umaga po.
Maraming salamat, Aya, sa iyong pagbabahagi. Ngayon naman, tinatawagan ko naman si Sheila May Agaraw. Isa po siyang woman with visual impairment at Secretary Nationwide Organization of Visually Impaired Empowered Ladies. Peer Coordinator for NCR Community-Based Peer Monitoring on the situation of women with disabilities amid COVID. Member din po siya ng BKK, Bantay Karapatan ng mga Kababaihang May Kapansanan. Sheila?
Hi. A blessed and liberating morning to everyone. My presentation is entitled Women with Disabilities Taking the Lead. I'll be sharing some of the initiatives of women with disabilities, particularly during the initial months of the lockdown. So next slide, please. Flashing your screen is a timeline of events regarding the initiatives of women with disabilities. So I arrange this way kasi para makita natin that there's continuity doon sa mga efforts ng mga kababaihang may kapansanan to really respond at makibahagi dito sa paglaban sa COVID-19. So there are 4 circles. Each circle has a date on it, and sa bawat circle ay nakaturo ito sa kung ano yung event o activity na nakatay doon sa date na yon. So, first circle is March 17 to April 17, 2021. It is the first wave of the community-based peer monitoring, followed by March 31, 2020, which is the issuance of DILG MC 2020-066. Then on May 1 to June 30, 2020 is the second wave of the community-based peer monitoring. And finally, December 21, 2020 is the launching of the BKKK. So ilan lamang po sila, at ang ilan sa mga ito ay patuloy pa rin po na kumbaga patuloy pa rin sa paglago katulad ng BKKK. So next slide po is guidelines on the proper welfare of persons with disabilities during enhanced community quarantine due to COVID-19. So this is the ILG Memorandum Circular 2020-066. So this started when Ms. Joey Santa Isabel of ESCR office emailed us novel and one of my colleagues, Gina Rose Balanlay, initiated a survey on the situation of persons with disabilities. Kasi tinanong kami, ano bang situation ninyo? And syempre, hindi lang naman yung sitwasyon namin ang kailangan sabihin namin, kundi yung sitwasyon ng nakararami. So that survey, nanganak siya, nagpatuloy siya, at naging nationwide itong survey na to, in partnership with the Philippine Coalition on the UNCRPD. And through that survey, we have nakuha namin yung mga needs of persons with disabilities as well as recommendations which was forwarded to CHR, and then CHR coordinated these recommendations to DILG, kaya lumabas yung MC 2020-066. At nagamit din siya ng Philippine Coalition on the UNCRPD sa susunod na wave ng kanilang survey, at sinama ito sa pag-send sa mga LGUs at kasama noong listahan ng mga constituents nila with disabilities. So, next slide is the community-based peer monitoring on the situation of women with disabilities amidst COVID pandemic. So, sa screen po natin are logos of different organizations of women with disabilities, such as Novel, WDare, Baulip, Blind Inc., Dawn, and this project is in partnership with CHR, Gender Equality and Human Rights Center, and with the support of UNFPA Philippines. Next. So, flash on your screen is a colorful map of the Philippines, with all its regions. Pero may binigyang emphasis yung NCR, and Region 7, Western Visayas, and Region 10, Northern Mindanao. So ito po kasi yung naging sentro noong mga peer monitoring. 55 women peer monitors with disabilities ang nagkaroon during this project, at tatlong women peer coordinators with disabilities dito mula sa tatlong rehiyon na to. Pero all in all, there were 2,382 responses sa mga mga kababaihan all over the Philippines. So, yun po yung kumbaga naging data na aming nakalap. Next slide. So what were the objectives of the community-based peer monitoring? So una, is to strengthen the partnership between the duty bearers and the rights holders. So, nakita dito sa peer monitoring na ito na if we really work together, genuine partnership within the government, the CSOs, and other stakeholders, magiging malaki ang impact nito, positibong impact sa buhay at kalagayan ng mga persons with disabilities. Although we're facing a pandemic, nandoon yung solidarity between the government and the rights holders. And it also strengthened yung network ng women with disabilities. Nagkamustahan sila, inalam nila yung sitwasyon ng bawat isa, at narinig yung boses nila, isang boses ng mga kababaihang may kapansanan. And the monitoring monitored the access to services and support from the local and national government, including the social amelioration program and all the benefits under the Bayanihan Heal as One Act. It also monitored the gendered impact of COVID-19 to women with disabilities, and also the possible experiences of gender-based violence and discrimination. At dito sa project na ito ay na-empower on individually and at the organizational level ang women with disabilities, as they were able to do evidence-based peer monitoring, at na-immerse sila sa mga sector-specific issues na kinakaharap ng kanilang mga kapwa women with disabilities. And yung meaningful participation. So ito talaga ang aim ng peer monitoring, kumbaga maging participatory, makasama ang women with disabilities in the planning and responding on COVID-19. Next slide. So, some of the key findings during this peer monitoring was, una is the financial and economic burden. So, loss of income had significantly contributed to food insecurity, kawalan ng access sa SRHR needs, kagaya na lang ng pagbili ng mga pills and other contraceptives, lack of access sa disability-related needs such as payment for sign language interpreter, personal assistant, captioner, lack of access sa kanilang rehabilitation services, regular checkups, and as maintenance of assistive devices. At ito'y pinalawig pa ng mga barriers sa information and communication, information about COVID, information about the support and services na meron, at maging yung physical accessibility ng mga lugar kung saan tumatanggap ng ayuda. At marami rin sa mga women with disabilities ang hindi nakatanggap ng mga support from the government. And it also magnified yung vulnerability ng mga women with disabilities sa gender-based violence and discrimination, even from the government people. There's an instance ng isang babae may kapansanan, namamaga yung implant niya during ECQ. Pumunta siya sa center, pero she was disregarded at sabi nag-imagine lang siya. There was also an instance na yung isang babaeng deaf na kapapanganak lang ay nakaranas ng emotional and verbal abuse from her in-laws. At yung mental health issues ng maraming women with disabilities because of the multiple burden, hindi nila ma-access yung kanilang gender and disability needs. Hindi nila alam kung anong papakain nila sa kanilang mga pamilya, and some of them who have children with disabilities had increased instances of tantrums and seizures. So nagpatong-patong, and some had contemplated na mag-suicide dahil sa mga pangyayari ito. So ilan lang yun sa mga naging findings during the peer monitoring. So next slide please. So bantay karapatan ng mga kababaihang may kapansanan. So nakita namin na talagang there's a need to be united at talagang maging kaisa ang bawat women with disabilities para i-monitor ang situation, human rights ng bawat isa. And kaya lumabas itong PKKK. So flash on your screen is the Lenovo tablet that we received from CHR and UNFPA Philippines. So itong itong device na to help us isa sa mga support for our inclusion. It helped us to still communicate with our fellows, monitor our situation, and to report instances of violation and abuse. It also helped us to continue to acquire knowledge and skills, and syempre to participate in this meetings like this and different fora, so our voices will continue to be heard.
Salamat, Sheila. Pwede dun sa ating last parting words para mabigyan na natin ng pagkakataon yung mga susunod.
Okay po. Sige, thank you. So, ang recommendation ay to have a gender and disabilities inclusive social protection, comprehensive accessibility for all the programs, services, and information on COVID. At pangatlo po is continuous empowerment on the rights and syempre economic empowerment of women with disabilities at meaningful participation in all levels of decision making. Thank you very much and good morning po.
Maraming salamat, Sheila. Susunod po natin ay si Ms. Corazon Clarin. President po siya ng WOW-LEAP Region 7 naman. Si Ma'am Cora po ay OIC ng Persons with Disabilities Affairs sa LGU po ng Cordova sa Cebu. Siya din po ang presidente ng WOW-LEAP sa Cebu Chapter. At she also serves as the convener of the Cebu Disability Inclusive DRR Network at Vice President ng League of Persons with Disability Affairs dito po sa atin. Ma'am Cora.
Thank you, Marcel. Good morning, everyone. As you can see in my slides, I entitled my talk as it says that women can and women with disabilities at the core of the fight against COVID-19. It has long been established that disaster and crisis impact women and girls differently. The COVID-19 crisis is not an exception. And for women living in disabilities, the intersection of their disability, gender, and socioeconomic status makes them more vulnerable and put them at the greater risk to the impact of the COVID-19 pandemic. So given this, our office has really put emphasis on the importance of data that would document the actual and specific needs of persons with disabilities, including women with disabilities, as they have different needs than the general disability population. Hence, as you would observe on my succeeding report, most of our initiatives revolve around data collection, management, and updating. Next slide, please. So on making pivots to the 2020 PDAO programs and plans. So to establish the impact of the COVID-19 pandemic to persons with disabilities in our municipality, we conducted a rapid assessment survey on the whole month of July. In developing the tool of the survey, we ensured that the needs according to gender were captured. Further, we tapped leaders and parent support group members as enumerators, 20 of whom were women. So in summary, this activity allowed us to achieve three things. One was the transfer of knowledge and data collection skills to community members. Second, we were able to provide them with cash for work. And most importantly, the data collected, we were able to come up with data on the status and experience of persons with disabilities during the COVID-19 pandemic. And our being part of the NCR's peer monitoring coordinator, as what Sheila had clearly explained in his report. Apart from my office local initiative, I'm also part of that monitoring, and that monitoring activity was a 4-month-long initiative organized and led by the Commission on Human Rights. As a result of this engagement, I was able to make policy recommendations for the formulation of programs and services on gender and development with a disability lens. And also on the compliance of the DILG monitoring survey on the status of persons with disabilities. This initiative resulted in updating the data of persons with disability in every barangay. Next slide, please. So apart from the fact that the conduct of this service helped our municipality to come up with evidence-based programs for persons with disabilities, including women with disability, it also led to strengthening institutional mechanism in our LGU. For one, it resulted to strong coordination and collaboration with the PDAO with the barangay officials and workers. Second, it opened doors to forge partnership with private and nonprofit organizations to have become our donors. And I believe that having an available, updated, and concise data encouraged them to donate as logistical and program requirements as easier to meet. Next slide, please. Also, and most importantly, these services allowed us to create a pool of volunteers and enumerators from our communities whom we can now proudly say have been trained and have a hands-on experience in collecting data. They had been trained on how to conduct a survey and the protocols needed to be observed in compliance to the Data Privacy Act of the Philippines. These enumerators were also provided with a debriefing and evaluation for them to learn lessons from the experience and identify good practices. I strongly believe that the enumerators have now become an important resource and asset of their communities in our future endeavors and interventions, and they can be tapped as volunteers and partners. By the way, the volunteers some of them are women with disability. Next slide, please. Overall, these experiences have allowed our office and the LGU in general come up with recommendations to further strengthen and enhance social service delivery, especially for the underserved sector of the communities. So as the pandemic, is expected to drag on. Next slide, please. Our role as PDAO, Ami and myself, has a very important role in ensuring that women are not left behind in COVID-19 recovery. Hence, we commit to leverage our position to advance the advocacy and interest of the other women with disabilities in the new normal society. To do this, we are making a conscious and deliberate effort to be more vigilant with the concerns of the sector, especially in the issues of discrimination, abuse, and exploitation. Thus, We continue being an active member of BKK, Bantay Karapatan ng Kababaihang May Kapansanan. And with this engagement, we continue documenting the complaints from women with disabilities and act on these cases by referring them to the proper agencies with follow-through activities and conduct regular capability building activities to provide of the information and knowledge that will equip and empower women with disability. As we all know, that knowledge is power. So develop and allocate budget for programs benefiting women with disability. Provide continuous coaching and mentoring activities to the different community groups we have organized, and strengthen coordination and collaboration between and among different stakeholders, both the government and non-government sectors. And it was also on this time of pandemic that we're able to organize and officially launch Istorya Hanay, an online platform wherein we just simply Istorya Hanay, sharing of good practices and sharing of knowledge within our local initiatives at the local level. And it's very also important to influence the local council to ensure participation of women and girls in decision making and increase the economic empowerment of women with disabilities and the general disability by promoting livelihood programs. So it is worth sharing that at present here in Cordova, we have a livelihood center, we have a market on wheels, and we provide pay or cash as a startup capital and augmentation of our members. And Ms. Ami also was able during this time, at the time of pandemic, able to organize WOW Live, a San Jose Antique chapter, and eventually that would be the Region 6 chapter. So next slide, please. At this slides to end up my talk, let me give you 3 takeaways to ensure that women with disabilities in particular are not left behind in COVID-19 recovery. First, it is important that we are viewed as capable of contributing and coming up with solutions instead of viewing as merely recipients of aid. Nakikita ninyo yung mga effort namin, lahat ng mga nag-report ng mga persons, ng mga women with disability. It is essential for policy makers, decision makers, and program implementers to make a conscious effort to make us more visible and heard. To do so, channels should be open and minimum accessibility requirements should be observed to ensure that our participation is meaningful and not tokenistic in nature. Basic accessibility requirements include provision of sign language interpreters for the deaf, materials and kits in Braille for the blind, and accessible venues for people in wheelchair, for example. Women with disabilities must also be represented in local decision-making council. No one should talk in our behalf as we can confidently speak for ourselves. Second, women with disabilities will not be left behind if we are recognized and accounted for. Thus, it is equally important that data are managed well and updated. It is not enough that data has been established in the beginning of the pandemic as circumstances and needs change over time. Regular updating is very important to ensure that future endeavors respond to what we need. And third, and but not the least, women with disabilities should be recognized as an important resource and asset. Those who have been trained with and have been engaged in the data collection must be continuously provided with capacity development training and other mentoring and coaching activities. And apart from that, access to information should be increased as knowledge is power, and having the right knowledge leads to good decision making for themselves, their family, and their community. Good morning, and thank you very much again.
Maraming salamat po, Ma'am Cora, sa inyo pong pagbabahagi, no? Nakita natin na sa tatlong nagbahagi, si Aya, si Sheila, at saka si Cora, na ibahagi na despite the disabilities of women, women are capable of leading their own communities in whatever way possible. But of course, we should be able to create those spaces para sa mga kababaihang ito, para sila ay maging ganap na mga aktibong miyembro ng komunidad at maging leader. No? Kailangan makita yung kanilang mga kakayanan, hindi yung kanilang disability bilang mga sagabal sa kanilang capacities to lead. Ngayon, papakilala natin si Miss Gina Rose Banlalay. Siya po ang magbibigay sa atin ng ilang pananaw tungkol po sa mga ways forward para sa mga women with disabilities. Si Gina ay founding member at treasurer ng Novel. Siya din po ang founding member ng Philippine Alliance of Women with Disabilities. Isa po itong organisasyon na member ng Philippine Coalition on the United Nations Convention on the Rights of Persons with Disabilities. At isa din po siyang volunteer member ng Bantay Karapatan ng mga kababaihang may kapansanan ng Commission on Human Rights at ng Gender Equality Women's Human Rights Center. Gina? Gina, it's your turn.
Can you hear me?
Yes, Gina.
Thank you, perfect. Okay, so a healthy morning, everyone. I will describe first the slide. So imagine a house. So at the base or bottom of a slide is a text, Universal Declaration of Human Rights. Next line are texts, CCPR, CSCR, CEDAW, CRPD, SDG, Enabling Master Plan, and CRC. Then a triangle or a roof with a text, Gender and Disability Inclusive Development. Below are 4 vertical lines or pillars. Each pillar has a text. So from left to right, awareness raising, participation, empowerment, and comprehensive accessibility. There are 5 rectangular shapes that straddle the pillars. These are physical, public transportation, information, communication, and ICT. There's another roof that overlap the mentioned roof. At the top of it is a photo of a lady justice with a sword and weighing scale. Then below is a text, twin track approach. And below the roof is a caricature of a smiling lady who is a wheelchair rider with a trophy on her right hand and her left hand raised up, symbolizing as a winner. Lastly, a sun at the top left part of the slide or roof with a text, or this is the recommendation, institutionalize the provision of monthly disability support allowance and implement Section 27-E of MCW or Magna Carta of Women. Okay, so how can we better help women and girls with disabilities at this time of crisis? How do we not leave them behind in COVID-19 response and recovery? We need a concrete and impactful solution. That is, to expand the social protection system for our legislators to support and adopt a universal disability support allowance to build back better so that it supports the resilience, inclusion, and dignity of all persons with disabilities, including women and girls of all ages across the country. We need a holistic and whole of society approach to make this recommendation real. Like building a house, we need a flooring for strength and stability. Universal Declaration of Human Rights principles should serve as the foundation of government agencies' policies and programs. Persons or women with mobility impairment need a ramp to enter the house. The International Human Rights Treaties, namely CEDAW, CRPD, SDG, and the Enabling Master Plan would serve as enabler of women and girls with disabilities from inequalities. We have to build a robust roof of gender and disability inclusive development, specifically on providing an adequate standard of living with its 4 pillars: awareness raising, participation, empowerment, and comprehensive accessibility. Awareness raising. We have to make all segments of society, including the family members and concerned disability sector, to be aware of our right to social protection, to remind the government agencies like NCDA, PCW, DILG, our Congress and Senate, their obligations under the different treaties wherein we ratified. They need to understand that the challenges faced by persons, women with disabilities at this crisis situation are not only in acquiring the daily needs, the basic daily needs, but also addressing their disability specific needs. So, there is a need to institutionalize the monthly 2,000 pesos disability support allowance, or at least 20% of the average food and poverty thresholds, to cover the basic disability-related costs faced by persons, women, and girls with disabilities. Aside from monetary support allowance, the existing in-kind support like access to healthcare services, mainly to SRH, should be available to women with disabilities regardless of their economic status, as they all face disability-related needs and extra costs. Also, the implementation of Section 27-E of the Magna Carta of Women to support women with disabilities on a community-based social protection scheme should be reinforced. Next pillar, participation. The meaningful participation of women and girls with disabilities, being influential in all stages of development processes of the institutionalization of the disability support allowance, its bill, and the reinforcement of MCW Section 27-E. Okay. So next is empowerment. Women and girls with disabilities have the power to make life choices and decisions to support the expansion of the coverage of the social protection to augment their socio-economic status. And last pillar is the comprehensive accessibility. Accessibility is not only in the physical environment, but also access requirements and support services for persons, women with disabilities should be provided to ensure that consultation and public hearing platforms or venues on all the initiatives relating to the enhancement of the social protection are fully accessible. Ibig sabihin po na ang pagtanggal ng lahat ng mga barriers that hinder the awareness, participation, and empowerment of persons, women, and girls with disabilities, and facilitate their inclusion. When we say inclusion, full inclusion through physical, public transportation, information, communication, and ICT.
Gina,
Yes
kung
po.
pwede ma-share mo na yung last words mo para magbigay daan din sa ating moderated discussion.
Okay, so aside from the mentioned pillars and the facilitators of inclusion, we have also there's also another roof. There's a photo of a Lady Justice would mean fairness and enforcement in providing equitable resources to break the cycle of disability and poverty. A twin track approach is a tool to achieve the recommendation. First, providing gender and disability-specific initiatives to support the empowerment of persons and women with disabilities and their family, including educating them on gender and disability-related needs and costs. Second phase of the twin track approach would be the integrating gender and responsive and disability inclusive measures into the design, implementation, monitoring, and evaluation of all policies and programs. NCDA, as the policy making, planning, monitoring, and advocacy body for the rehabilitation and equalization of opportunities for persons and women and girls with disabilities, should support the passage of the disability support allowance. How about the as well as the PCW? So they would work hand in hand for us to ensure that women with disabilities will not be left behind at this time of crisis. And we can say that women and girls will rise above COVID-19 pandemic. Thank you and mabuhay.
Maraming salamat, Gina. Nakakatuwa na ito ang mga binahagi mo at magandang tungtungan ito para sa ating moderated discussion. Kasama natin, no, in fact, ang National Council of Disability Affairs at ang Philippine Commission on Women, dalawa sa mga ahensya na iyong nabanggit. May I now call on Engineer Emerito Rojas, who is the Executive Director of the National Council of Disability Affairs, for his thoughts about all the presentations.
Magandang umaga po sa inyo lahat, and I'd like to thank each and every one of you for inviting me here. Napakaganda po nitong webinar po natin ngayon, and sa mga napakinggan ko ay napakaganda po ng mga ginagawa po natin sa kababaihan. Let me share some insight about let me start with the quote from the UN General last April 2020. Ito po yan, sabi niya, limited gains in gender equality and women's rights made over the decades are in danger of being rolled back due to the COVID pandemic. Ibig sabihin po niya ay kailangan mas paigtingin pa po natin ang mga ginagawa natin ukol sa gender equality, meaning sa mga kababaihan po. At ito pong ginagawa natin ay napakaganda. Ang NCDA po ay may itinalagang trust and direction ngayon taon na to. Unang-una po ay capacity building. Bakit po capacity building? Naniniwala po kami dito sa NCDA na ang mga may kapansanan, kasama na po yung kababayan, ay dapat kasama po sa ating development. Hindi lang po tayo recipient ng mga ginagawa po ng gobyerno. Ano po, tayo po ay kakibay, kapartner. Dapat po ng pamahalaan sa mga ginagawang yan. At kakibat po natin sila, lalo na yung mga kababayan sa mga disability sensitivity training natin at iba-ibang mga awareness program, like for example yung basic legal processes na ginawang orientasyon, and several webinars on gender equality and women disabilities. Kasama na rin po yung edukasyon at iba-iba pong mga webinar series na ginawa, including yung most recently yung ICT and economic empowerment of women with disabilities na ginanap a few days ago. NCDA also provides technical assistance in the conduct of webinars. Kaya kung halimbawa, kailangan nyo po ng Zoom account at may gusto po kayong gawin talakayin, sigapin po namin na mapagbigyan po yun kung kailangan, ano po, at kung available mo. Alam niyo po rito sa NCDA ngayon, kagaya ngayong araw na to, ito na po ang pang-apat na meeting mula kaninang alas 8 na pinasukan po natin. At talagang gamit na gamit po yung mga Zoom accounts po natin dito sa NCD. Kaya it's a matter of sharing the resources that we have hanggat maaari po. And we also try to or help in organizing the federations that includes women with disabilities in the different regions. Naniniwala po kami na ang mga federation po natin, including women with disabilities, can play a big role in the upcoming Mandanas ruling. Alam naman po natin na ang Mandanas ruling ay lalabas po yan by next year at kailangan pinaghahandaan po ng bitaw yan. Ngunit ang bitaw with the meager manpower complement that they have needs people to work on the ground. Kaya napakalaga po na ang ugnayan ng bitaw at ng federasyon upang may baba po ang serbisyo sa mga may kabansanan. Ulitin ko po, ang tema po ng NCD ngayon ay kakibat, kapartner po ang mga federasyon, ang mga samahan, including associations of women with disabilities in the development po ng ating sektor. Hindi na po recipient lang, kasama po at nakikipag-ugnay po kami sa mga bitaw upang ito po ay magawa ng mabuti. There are also several others that we have done on the policy side. Ito lang po may share kung isa. Kahapon po ay nagkaroon ng meeting ang DTI together with the other stakeholders including NCD regarding e-commerce. Marami po tayo kasing reklamong natatanggap dito sa NCD na bakit walang diskwento yung mga binibili natin na online at ito po ito sa mga ito po yung tinalakay actually sa e-commerce administrative order na binabalak mong ilabas ng DTI at maganda po itong development dahil pati na po mga online services mga ito po yung napatupad ay mayroon na po ring diskwento para po sa mga may kabansanan. So, dito rin po sa NCD, mayroon po tayong ginawang manual on gender and equality focusing on women with disabilities. We can talk about this later at a different venue kung gusto nyo po ng detalye nito. And well, I think that's about it that I can share to you right now. And again, congratulations to the organizers of this forum. Napakaganda po itong ginagawa natin. Sinususukan po ng NCDA po ito at tuloy-tuloy po natin ito para po sa pagpapalakas, hindi lang po ng kababayan, kung hindi para po sa buong sektor. Okay, so maraming salamat, Mr. Edward Delio of Humanity and Inclusion. Thank you for inviting me here. Maraming salamat po.
Maraming salamat po, Engineer Emerito Rojas. Maraming salamat po dun sa inyo pong mga updates at na mukhang ginaganahan po kami lalo sa inyong mga updates na meron na po pala kayong nagawang manual on gender responsive disability parang manual po no for being gender responsive to people with disabilities. At maganda po siguro nga talagang mabigyan ng pagkakataon ito na marinig no in a different venue kasi kulang po tayo sa panahon. At mainam din po yung sinusulong ninyo na diskwento sa online businesses, no? Tama po yan. Mukhang nakalimutan ho ata yan ng ating mga mambabatas at saka din po ating mga nagpo-programa ng mga ganitong mga bagay para maibsan din po yung mga yung costs no sa ating mga kasamahan na persons with disabilities. At mabigyan ng pagkakataon yung mga kababaihan na nag-online selling, no? Yung mga women with disabilities na nag-online selling, mabigyan po sila ng pagkakataon para makapasok din po sa mga ganitong platforms. Marami pong salamat at sisiguraduhin ho namin may pagkakataon ho ang NCDA para i-share ho itong mga updates po ito patungkol sa mga kababaihan and succeeding opportunities. Next, ang ating pong kaibigan, Attorney Christine Rosary Yuson Chavez. Siya po ang Executive Director ng Philippine Commission on women. No? So we hope to hear from her today also about her thoughts on our activity. Edie Cray.
Hello, Marcel. Good morning. Good morning then to all our participants this morning. In behalf of PCW, may I share some insights on the initiatives undertaken by PCW to help women with disabilities. So, persons with disabilities comprise about 12% of Filipinos, and they experience different forms of marginalization because of the disability and other structural barriers existing in our society. So, as pointed out by the Advocates for Inclusion Network, the Accessibility Law or BP Bilang 344 in the Philippines was unsuccessful in making mobility inclusive in the country, with many buildings, sidewalks, roads, and public transportation remain unsuitable for wheelchair, blind, and deaf users. They also emphasized that the exclusion of persons with disability in the 2015 census made them statistically invisible to the state due to the lack of information concerning them. This makes inclusion a challenge for various social protection measures, as shown in their marginal participation in some of the government's poverty reduction programs. And even when programs and services are available, they continue to experience difficulty in accessing these due to inaccessible building environment and lack of inclusive measures in service delivery that consider the needs of persons with disabilities. Based on the 2016 National Disability Prevalence Survey, women are more likely to experience severe disability at 15% and moderate disability at 45% compared to their male counterparts. The existing challenges confronting persons with disability are doubled for women and girls, and even for persons with diverse sexual orientation and gender identity and expression, due to the intersecting layers of marginalization and discrimination affecting their sectors. For women and girls with disability in particular, the negative impacts of the COVID-19 pandemic further increased their vulnerabilities to economic disempowerment, such as gender-based violence, particularly sexual harassment, rape, and human trafficking, as well as unintended pregnancies resulting from these violence. The Philippine Commission on Women, as the primary policy-making and coordinating body on women and gender equality concerns, serves as the oversight body on women's concerns and acts as a catalyst for gender equality and women's empowerment in the country. As such, the PCW monitors and upholds the Magna Carta of Women, which seeks to eliminate discrimination against women by recognizing, protecting, fulfilling, and promoting their rights, especially those coming from the marginalized and vulnerable sectors such as women and girls with disabilities, by taking into consideration their gender differentiated needs. The law also recognizes and addresses abuse committed against women with disabilities and protects their right to education. While the PCW do not have direct programs and services for women with disabilities, the PCW, as part of its mandate, undertakes continuing advocacy to promote the economic, social, as well as political empowerment of women, including women with disabilities, through policy development and advocacy to ensure that their gender differentiated needs and concerns are integrated into our laws, policies, and various government plans, especially during crises such as the pandemic. For instance, PCW's review and endorsement of gender and development plans and budgets, or GPBs, of government agencies forms part of our continuing advocacy for the development of GAD programs and services that would benefit all women, including women with disabilities. When the enhanced community quarantine was imposed over Luzon and several parts of the country due to the COVID-19 pandemic, the PCW released a supplementary policy, including the adoption of gender responsive temporary emergency measures to respond to the needs of vulnerable sectors, such as women and girls with disabilities, given the pandemic. Due to the limited mobility and enforced confinement brought about the imposition of community lockdown
put women and girls, especially those with disabilities, more at risk to abuse and violence in their own homes. As such, the PCW, together with several other government agencies, released a joint solidarity statement enjoining all GBV response units, barangay VAU desks, PNP Women's Desk, and Women and Child Protection Units to respond quickly and effectively to all reports of GBV using a survivor-centered approach. We also called upon the LGUs to maintain functional GBV referral mechanisms for efficient response and urged victims to step forward and seek help. In addition, the PCW, together with the 911 National Emergency Office and the Asia Foundation, signed a memorandum of understanding to include VAUSI emergencies in the 911 National Emergency Hotline. It is our hope that through this initiative, we will be able to strengthen the government's response to VAUSI cases by facilitating the coordination of emergency rescue and assistance, providing gender-sensitive psychological first aid, and referring the survivors to needed rescue and response resources. Further, the PCW, with the Interagency Council on Violence Against Women and Their Children, or the AYAC-VAUSI, coordinated efforts to harmonize and systemize the collection of data on violence committed against women and girls, including those with disabilities. So for this purpose, the data field on persons with disability is included in the VAU standard intake form. The data field also includes options on the specific type of disability, which will help in collecting more inclusive data on VAU. Notably, the inclusion of women and girls with disabilities in the standard VAU intake form is aligned with one of the strategies in the Women's Edge Plan, which is to advocate the integration of gender disaggregated data on disability by type in regular data collection activities of national and government agencies. In 2020, the PCW also provided capacity building assistance to 172 persons with disabilities and senior citizen women micro-entrepreneurs nationwide through our Great Women Project 2. Moreover, the PCW continues to advocate and support for the passage of bills that aim to address the needs and concerns of women, including women with disabilities during crises such as the pandemic. One of the bills that we are supporting right now in Congress is the Gender Responsive and Inclusive Pandemic Management Act of 2021, which aims to enforce access to social protection and safety nets and involve women, including women with disabilities, in the formulation of guidelines in the national management of the pandemic. The proposed legislation aims to ensure access to and the continued functioning of gender desks and health services and appropriate funds to secure these programs. As we continue our fight against the COVID-19 pandemic, the PCW would like to reiterate our recommendation for all government agencies and relevant organizations, particularly those that provide direct services to disaggregate data of beneficiaries by sex, age, disability, and other relevant status to analyze gender differences, inform decision-making, and ensure inclusivity in the delivery of gender-responsive programs and services during this time of the pandemic. We also recommend that government agencies and concerned organizations to continue to conduct research and studies such as needs assessment, amplify the discussions on the different challenges confronting women with disabilities during the pandemic, and strengthen interagency collaboration through the conduct of various fora and webinars. Intensify awareness among women with disabilities on the available programs and services in the community and ensure that these are accessible for them to avail. Support the advocacy of the passage of bills and other measures that help respond to the needs and concerns of women with disabilities during the pandemic. Provide opportunities for their economic empowerment through various capacity development and skills enhancement programs, and encourage women with disabilities to join organizations such as self-help groups in their communities that will help promote their welfare and advance their interests so that they can be empowered to speak for themselves to participate in decision-making bodies, and to proactively engage with government and other organizations in creating more inclusive, gender-responsive, age-appropriate, and effective policies and programs. Finally, PCW enjoins all government agencies and development partners from the private, non-government, civil society, and people's organizations to continuously collaborate with us as we sustain and strengthen our collective efforts towards responding to the needs and concerns of women with disabilities during this time of the pandemic. Thank you for your time and good morning once again.
Maraming salamat, ED Cray, sa inyong mga updates also on the efforts being made through PCW on promoting the rights of women with disabilities. Sayang lang at hindi natin nakasama ngayon yung office ni Senator Risa Ontiveros, but she's sending her warm greetings to all of us because she is currently having a virtual public hearing today in Senate for the legislative proposal. Kasabay natin ito, the Gender Responsive and Inclusive Pandemic Management. No? So our discussions here today will be sent to her office so that she could consider this also in the legislative proposal now in the Senate. Meron pa tayong konting panahon, siguro just to also engage also some of you for some Q&A. Meron na kaming na-pick up dito na isang tanong, no? Are there concrete actions taken by your organizations in involving women with disabilities or in addressing the issues and concerns of women with disabilities? And how do you plan to integrate the results of the survey or peer community monitoring to respective organizations? I think this could be addressed by some of our speakers. So I would request also that our speakers, if you want us to share your email address so that our participants could reach you, just let Cami, Adle, and Ana Vineles know if you consent in sharing your email addresses so that we could address these questions. I think these two questions have already been addressed by our speakers, but perhaps there could be more information that could be shared through bilateral emails. So maraming salamat po. Now, we're going to now ask all of you for a very important aspect of this activity, which is the call to action to supporting women with disabilities. Our discussion and our work for women with disabilities does not stop here. Istorya Hanay, with the support of Humanity and Inclusion and UN Women, will be leading and putting forward the call to action to support women and persons with disabilities, especially as the pandemic continues to drag longer. For this reason, we wanted to ask for your commitment and support by signing your name on the screen. I-feature po natin. Ito po yung kanina ipinakita ni Miss Gina. No? So sa photos po sa photo po na ito, meron pong babae na nakaupo po sa wheelchair. May hawak po siya na isang trophy at kita po niya yung vision of institutionalizing, sa isa po siyang araw, institutionalizing the provision of monthly disability support allowance at ang implementation po ng Magna Carta of Women Section 27-E. Tanaw din po nitong babaeng ito na nakaupo sa wheelchair, yung pong bahay na nasa bubong po niya ay yung Gender and Disability Inclusive Development na pinalalakas po ng 4 na pilar. Ito po ay ang awareness, participation, empowerment, accessibility. At sa baba po nito, ang kanyang pundasyon, ay yung iba't iba pong UN mandates, yung Universal Declaration of Human Rights, iba't iba pong international mandates at International Declaration of Human Rights. Sa kabila po, meron din pong isa pang bubong. Nakalagay po doon yung twin track approach kung saan ina-achieve po yung sinusulong po ni Lady Justice, no, yung pagkakaroon ng access to justice po ng ating mga babae, women with disabilities, no. Kaakibat din po pala, sorry nakalimutan ko, doon sa naunang bahay na may bubong na Gender and Disability Inclusive Development ay yung iba't ibang aspeto ng physical, public transportation, information, communication, information, communication technology. So, kung kayo po ay sumusuporta sa ito pong mga vision pong ito at panawagan sa mga sa gobyerno at sa iba't iba pa pong mga pertinent organization katulad po ng private sector, no, siguro academia, isama na din po natin. Please let us know if you agree with it. And you may use the annotate feature of Zoom. Sa mga mobile phones, pwede po may makikita po kayong pen icon sa ibaba, lower left hand po ng inyong screen na pwede nyo pong i-click para po maisulat po ninyo ang inyong agreement po dito sa vision po na ito, call to action po natin ito. Alternatively, pwede nyo din pong gamitin yung ating chat box at ilalagay po ng ating tech team ang inyo pong pangalan dito po sa screen na ito. Doon naman po sa mga gumagamit ng laptop, yung annotate feature po ng Zoom ay nasa top po ng inyong screen. Paki-scroll po yung inyong screen, makiklik nyo po yung annotate at mailalagay nyo po yung inyong, you click on the text and click anywhere po sa diagram natin para makapag-sign ng inyong pangalan. Sa mga kasamahan po natin na nasa FB Live, kindly indicate your names and willingness to support women with disabilities on chat. Isasama din po ang inyong pangalan sa diagram. So abangan po natin ang inyo pong mga commitments to support the call for action for supporting women with disabilities. So may nakikita na po kami sa screen. Okay. Yan, nilalagay na po ng ating tech team, no, yung mga pangalan po dito sa diagram na ito. Salamat po. Okay. So si Sheila din po, isama din daw natin. Ang cute naman ng pagkakasulat ng pangalan ni Deb. Salamat,
Ayusin ko po.
Deb. Okay naman. Hindi, okay lang yan. Cute naman. Muli, no, sa mga gusto pong maisama yung kanilang pangalan sa ating diagram, ilagay lang po natin yung pangalan natin, either po sa chat box or gamitin po natin yung annotate feature ng Zoom kung saan pwede po ninyong i-click at yung annotate feature para po masulat po ninyo yung inyong pangalan. So ngayon po, nakikita na po natin yung pangalan, no, ng ating mga kasamahan. May 1, 2, 3, 4, 5, 6, 7 na mga pangalan sa ating pong diagram na sumusuporta doon sa call to action. Naku, may puso-puso pa, nakakatuwa naman. May 10 na po tayong pangalan sa ating pong screen. May mga pangalan na rin pong lumalabas sa ating chat box, so sana maisama din po natin sila. Salamat po sa inyong suporta. Maganda po na ito pong ating ginagawa na ngayon ay talagang mailagay natin yung ating pagsuporta kasi ito po ay madodocument, no? At maipapadala sa iba't iba pong mga ahensya, hindi lamang po ng gobyerno, pati din po sa United Nations, no? Katulad din po ng UN Women na siya pong nag-co-organize kasama ng Humanity and Inclusion para po masulong, no, yung boses ng mga kababaihan with disabilities. No? So mabuti po na ito po ay ma-share din po sa mas malawak po na sphere. Naku, salamat po. Patuloy na dumadami, no, yung mga pangalan na nandun po sa ating call for action. Sige po, maraming salamat po. Continue putting the names, no, dito po sa ating chat box at pag-annotate, no, dahil mamaya-maya po ay siguro po before also we end our activity, ipakikita din po natin ulit ito kung sino-sino na po ang commit, no, to support the call to action. We will just be asking our graphic recorder, si Desdi, to get ready because she will be next in sharing with us yung ating graphic recording ng ating pong discussions. Meron po tayong graphic recording, no? Yung kumbaga synthesis ng ating pong napag-usapan. So, let us know, Des, if you are ready so that we could shift the screen. Yung tech team naman ay continuously i-update yung ating pong call to action.
Hi, Marcel. I'm about to share.
Sige.
Give me a second.
Sige.
Okay. Yes. Ayan. So, thank you sa lahat for a very rich discussion today. I'll be more descriptive as requested by the participants for the graphic recording for today. So, nag-umpisa tayo with the welcome message of the inclusion of women with disabilities, especially sa COVID-19 response and sa policies and programs. And then as for the situationer, yung impacts na pag-usapan ay unemployment. I drew this with a suitcase, and then no funds to buy maintenance medicine. And then having anxiety, paying bills and rent, lack of social interaction causing emotional fatigue. I drew this with a black cloud and an anxious person. And the closing of businesses, losing sources of income, the difficulty to access medical services. There was a very powerful quotation here saying, if I get COVID, will there be an interpreter to help me out? And increase in gender-based violence and discrimination, having difficulties in commuting. Dito nag-draw ako ng jeep as described by our first speaker because of the regulation and lockdown and difficulties in mobility. And then, nagiging priority ang survival over education. And dito I drew a bowl over a book. And carrying multiple burdens. A person in a wheelchair carrying a lot of rocks. And then sa learnings naman, I drew a net because catch yung acronym na ginamit. And for catch, it's collaborate, adjust, technical learnings, communicate, and health consciousness. Okay, and as for leadership and participation, taking action on sexual and reproductive health, nagbigay lang rin ng context on the problems they are facing, such as forced sterilization, lack of sign language interpretation, access to information, physical and attitudinal barriers. Nag-draw ako ng isang ladder dahil mahirap i-access. And then insensitive healthcare service providers. And as for some initiatives that were mentioned by our speakers, are guidelines on proper welfare of persons with disabilities during ECQ. And dito may paper with a check and X as parang do's and don'ts. And then community-based peer monitoring. It's a table with stakeholders and representatives. And then it's important to strengthen partnerships of duty bearers and rights holders. And these initiatives have been important in monitoring government response and seeking accountability. Dito I drew a magnifying glass with an eye. And then how there is now a pool of volunteers for data collection. And the vision really is comprehensive accessibility, drawn with a ramp with fast forward icons, social protection illustrated with a safety net, and empowerment. And it's really important to be recognized as an important resource and asset and to be accounted for, and that the sector is really capable of leading. And as for the way forward for women with disabilities, this was the illustration earlier that was very clearly described by Gina, so I won't go into it, but eventually the call is really to institutionalize support for disability allowance in Section 27E of the Magna Carta for women. And as for government response, the main message here is that kaakibat talaga tayo. We are partners, not tokens. There has been strong capacity building and grassroots support. There has been a manual made for gender responsive inclusion, and how people with disabilities have been statistically invisible, and in-enumerate lang mga interventions for an inclusive response, and how all of these are really working towards promoting, protecting, and encouraging the social, economic, and political empowerment of the sector. So ako po si Desiree. Salamat po sa inyong lahat for letting me draw the big picture with all of you.
Maraming salamat, Des. As always, you amaze us with your graphic recording, at ngayon ang added value ay may description na talaga ng ating discussions. Maraming salamat, Des. I think napakahalaga na na-capture ni Des at ng ating mga speakers na yung hindi tayo dapat tinitingnan, women with disabilities should not be seen as merely tokens, At ito ay nagsisimula sa pagtingin doon sa basic na foundation, which is respecting, protecting, and fulfilling human rights, no? So kung tinitingnan natin na ito ay hindi isang token kundi kabahagi ng pagrespeto ng karapatan ng mga kababaihan na may kapansanan, mas makabuluhan yung ating pagkilos, no, to address not only the needs but especially fulfilling the rights of women with disabilities. Um, kanina naputol si Ed, no? So, i-alert lang kita, Ed. Mamaya ay pasasalitain ka namin ulit. We will just like to ask the technical team to once again raise how our call to action now looks like, para makita ng ating mga kasamahan gaano na karaming tao ang nag-sign up for support. Wow! Punong-puno na at halos hindi na mahulugang karayom ang ating call to action, no? So maraming salamat sa inyong support, no, and we hope that this does not just only end here by writing our names, but really pushing for more measures, legislative as well as programmatic measures to address the needs of women with disabilities, no. So we've heard a lot about it today, and we hope that this will be more into the consciousness of everyone, that we should be responding, taking a note of the rights of women with disabilities. Maraming salamat po. So, palakpakan din naman natin yung mga nag-support, no? Maraming salamat. So now, let me call back Ed of Humanity and Inclusion. No, naputol ang ating usapan kanina. So we want you to share some of your words also again for our participants.
Thank you, Marisa. Thank you. Can you hear me?
Yes, we can hear you.
Okay, salamat po. So, kinocongratulate ko ang lahat ng organizer, speakers, and the reactors sa ating executive director from the Philippine Commission of Women, ang ating kaibigan na si Sir Emer at ang kanyang mga kasama sa National Council on Disability Affairs. At syempre, ang ating mga co-organizer, UN Women, at ang ating Organization of Persons with Disability. So, sobrang napupuno ang aking puso sa nadidinging magagandang experiences at magagandang sharing ng ating mga women with disabilities. So, pinapatunayan lang na to na mga study patungkol sa mga women with disabilities ay tunay na nag-increase sa panahon ng pandemya. Hindi lang kasama dito yung emotional, physical, and sexual abuse, which is compounded by the social context of disability. Kasama dito yung pervasive discrimination. Kaya nga nais ng talakayan nito o yung series of online session ay matuto, no, how to learn the leadership and meaningful participation of women and girls with disability in all decision-making processes. In addressing the COVID-19, no, ito man ay response, rehabilitation, o anumang programa, maging pampubliko at pangpribado man, so that women with disability will not be left behind and denied their rights, neither discriminated on the grounds of disability, health condition, gender, or age. As observed, na nakita po natin na present ng ating mga butihing na nagsasalita at pinakita din sa mga studies na women with disability clearly stated that we need to work together as community and work harder in the name of justice for and on behalf of persons with disability, including women with disability. so that women with disability become more resilient in the times of COVID-19. Finally, I salute all women with disability in their own way, providing untiring support to their family and community. So pinakita kanina na marami pong hadlang, barriers na dapat nating sirain o biyakin katulong ng iba't ibang organisasyon. Ipinakita rin ng ating talakayan na tunay na may kakayanan ang mga babae, may kapansanan. At ipinakita nila sa kanilang maliit na bagay, sa kanilang kapasidad na tumulong sa komunidad sa pamamagitan ng kanilang kakayanan. Kaya muli, maraming salamat po at magandang umaga po sa lahat. Thank you.
Salamat, Ed. Salamat din sa Humanity and Inclusion for partnering also with you and women on this very important activity. I hope that this served as an opportunity also for women with disabilities to really be heard and that they are considered also in all development processes that's being done. Last but not the least, let me now call on Cami Adle, UN Women Program Analyst for COVID-19 and Humanitarian Action.
Ayan. Magandang tanghali po sa lahat at maraming salamat po sa lahat ng nag-stay on hanggang po sa pagtapos ng aming discussion ngayong araw. Sobrang pasasalamat po kana Engineer Emir at kay ED Cray. Thank you so much po sa pagpapaunlak ng aming imbitasyon ngayong araw. Sa lahat po sa inyo na nagpahayag po na inyong commitment sa tuloy-tuloy na pagsuporta sa mga women with disabilities. Simula pa last week, talagang napakarami na nating narinig ng mga storya ng mga kababaihan ngayong panahon ng pandemic. At totoong nakita natin na hindi pare-pareho ang epekto ng pandemic sa ating lahat. Kaya hindi maaaring magtapos rito ang usapan, hindi maaaring dito magtapos ang diskusyon at ang pagpaplano at pag-angkin ng ating mga karapatan. Kailangan po natin ituloy-tuloy. Marami pa tayong gagawin, pero marami tayong magagawa kung sama-sama natin gagawin. Gaya nga po ng sinabi kanina ni Marcel, ang lahat po ng mga dinidiskusyonan po natin, lahat ng mga nabibring up natin sa ating discussions, ay ilalahad po natin sa isang report na gagamitin po, na isang submit po natin kay Sen. Lisa Ontiveros at saka sa iba pa nating mga champions within the legislation para po maipasok po ito sa mga bills na ginagawa po at masigurado na ma-institutionalize yung mga sinasabi natin dito na agreements at mga mga agreements at mga gusto nating marating sa ating mga plano at mga programa. Siguro po na lang po reminder na lang po para sa lahat na meron pa po kaming natitirang isa na discussion po natin. Women Rise Above COVID pa rin po. Pero open po ito para sa general public. At inaanyayahan ko po sana ang ating mga organizations na nandito, ED Cray, Engineer Emir, kung maaari po sanang imbitahin po natin ang ating mga kasama, ang ating mga networks, ang ating mga community partners. Kasi next week po, sa May 18, ay usapang bakuna. So tayo po ay magpo-focus sa COVID-19 vaccines. At maaari po kayong magtanong through FB Live, through Zoom, ng lahat ng mga hindi malinaw tungkol sa COVID-19 vaccines, sa plano ng government. At yun po ay isang espasyo na atin pong binubuksan para makapagtanong po kayo kung hindi malinaw. Kung may hindi malinaw tungkol sa COVID-19 vaccines. Ipapadala po namin sa inyo ang mga links kung saan po kayo mag-pre-register at kung saan nyo po mapapanood sa FB at papatulong din po kami sa Humanity and Inclusion na i-share din ang poster ng magiging event. Pero sana po makita po namin muling kayo doon at sana po ang lahat ng aming diskusyon ay nakakatulong sa ating lahat sa ating mga ginagawa. Muli po, maraming salamat sa inyong lahat at stay safe po, stay healthy. Ingat. Maraming salamat po.
Maraming salamat kami. Pasasalamat sa lahat po ng ating speakers at mga reactors po ngayong araw na ito. Salamat din po kay Des Llanos D of Tofu Creatives para po sa kanyang creative synthesis. Salamat kay Miss Gina sa inyo pong diagram na nagsilbi na naging platform natin para sa call to action to supporting women with disabilities. Maraming salamat po sa ating dalawang Filipino sign language interpreters, si Jojo at si Bayani, at sa ating pong captioner na si Romeo. Maraming salamat po sa inyong pagtulong at paggawa po nitong activity na ito bilang inclusive at responsive sa ating mga women with disabilities. Maraming salamat po at see you po next week. Usapang bakuna po tayo sa Women Rise Above COVID. Thank you!
Thank you so much, everyone!